This video is for educational use only. What is intermittent fasting and why is it important? Intermittent fasting is an eating plan that switches between fasting and eating on a regular schedule. Research shows that intermittent fasting is a way to manage your weight and prevent or even reverse some forms of disease. But how do you do it? And is it safe? Many diets focus on what to eat, but intermittent fasting is all about when you eat. With intermittent fasting, you only eat during a specific time. Research shows fasting for a certain number of hours each day or eating just one meal a couple days a week may have health benefits. When you fast, several changes occur in your body at the cellular and molecular levels. Firstly, insulin levels drop significantly, making stored body fat more accessible. During fasting, the body also initiates important cellular repair processes, including autophagy. Autophagy helps in preventing diseases and promoting longevity. Increased levels of this hormone can facilitate fat burning and muscle gain. First, human growth hormone, HGH, levels go up and insulin levels go down. Your body's cells also change the expression of genes and initiate important cellular repair processes. Weight loss is the most common reason that people try IF. By reducing the amount of time you can eat, you'll likely consume fewer calories without realizing it. Additionally, IF can affect hormone levels and aid in weight loss. In addition to lowering insulin and increasing HGH levels, IF increases the release of the fat-burning hormone norepinephrine, noradrenaline. Because of these changes, short-term fasting may temporarily increase your metabolic rate. According to research, IF can be a powerful weight loss tool when done safely. A 2020 systematic review of studies on people with overweight and obesity showed rates of weight loss ranging from 0.8% to 13% of participants' starting weights. However, most of these studies were small and done over a short period of time. Keep in mind that the main reason IF helps with weight loss is that it makes it easier to eat fewer calories overall. If you eat massive amounts during your eating periods, you may not lose any weight at all. Here are some changes that occur in your body when you fast. HGH. Your levels of HGH increase. This can help with both fat loss and muscle growth. Insulin. When you fast, insulin sensitivity improves and levels of insulin decrease. Lower insulin levels make stored body fat more accessible. Cellular repair. When fasted, your cells initiate cellular repair processes, which means cells digest and remove old and dysfunctional proteins that build up inside them. Gene expression. Fasting can cause changes in the function of genes related to longevity. Moreover, fasting affects hormone levels, leading to higher growth hormone levels. The overall effect is a reduction in body fat, improved metabolic health, and a decrease in the risk of chronic diseases. Different methods of intermittent fasting. The 16-8 method is one of the most popular ways to practice intermittent fasting. This involves fasting for 16 hours and eating within an 8-hour window. Another method is the 5-2 diet, where you eat normally for 5 days a week and restrict calorie intake on the other 2 days. The Eat-Stop-Eat method involves fasting for 24 hours once or twice a week. Choosing the right method depends on your lifestyle and preferences. It's essential to pick a method that you can stick to in the long term. This ensures you reap the full benefits of intermittent fasting. How often should you fast? The frequency of fasting depends on individual goals and lifestyle. For beginners, starting with a couple of days a week can be a good approach. As you become more comfortable, you can increase the frequency. Many people find success with daily fasting, such as the 16-8 method. However, it's important not to overdo it. You might choose to fast on weekdays and take weekends off to balance fasting with social activities. Safety and side effects. Hunger is the main side effect of IF. You may also feel weak, and your brain may not perform as well as you're used to. This might only be temporary, as it can take some time for your body to adapt to the new meal schedule. If you have a medical condition, you should speak with your doctor before trying IF. This is particularly important if you have diabetes, have problems with blood sugar regulation, have low blood pressure, take medications, are underweight, have a history of eating disorders, are trying to conceive, have a history of amenorrhea, are pregnant or nursing. Always remember to listen to your body and consult with a healthcare provider. Thanks for watching. Please visit our website healthdove.com.